Hi, my name is Emily Iannelli, and I'm a male to female transgender woman. And I've been waiting a lifetime for transitioning from male to female. I started my transition in March of 2012. I've tried much earlier than that, but my actual time of beginning the whole process of transitioning from male to female was in March of 2012. I had found out on a website that Callan Lord in the city caters to the LGBT community, and you can actually be prescribed hormones if they deem that you are true to your word that you are transgender, and that you give them your informed consent. So when I first went to meet with my doctor, her name is Dr. Juliet Woodruff, and she's still my doctor at Callan Wood, and I told her that I am struggling with gender issues. I identify as female, and I went in a business suit, a gentleman's business suit, because I was working in the accounting profession, and I said, I'm here to seek treatment so I can transition from male to female. And she looked at me and she said, are you sure you want to transition to become a woman? And I said, well, I've always known, I knew when I was 3 that something wasn't right. So she saw me in my suit and tie, and she questioned why I wasn't dressed more in line with a woman. And I said, well, you'll see. And she said, okay, we need to do an examination, make sure all your vital signs are good. So she's asked me to take my shirt off so she could do, with the heartbeat. And that's when she discovered I was wearing a dress underneath. And she started to realize that I was serious. She saw that I was dressing in women's clothes underneath my male attire, and she wasn't surprised. She said she's seen that many times with other transgender women. So she said, well, if you want to go on hormones, you need to see me for the next 3 months. And after that, we'll determine if you're really ready to start on hormone replacement therapy. So after the 3 months elapsed, and I had my appointment with her, she was true to her word. And I was too, and I said I'm still desiring to start my transition from male to female, and she knew that I was serious, and that's when she prescribed me estradiol and spironolactone. The estradiol is for the estrogen for women, and the spironolactone is to suppress the testosterone. So I will be able to start my transition on these hormones and blockers. And she gave me a timetable and said that you're starting in June of 2012, so most likely you'll start seeing changes to your physical characteristics within 9 months to a year, maybe sooner. And I said, what kind of changes should I expect? And she said, well, for starters, you're going to notice that your skin is going to become softer in your face, your arms, legs. It's going to be more softer as a woman's skin. You're going to also notice some changes within your facial structure. So she said you don't need to consider any kind of surgery for your face, and just be patient. And she also said that you will develop breasts, and eventually you'll have to start wearing bras to cushion, keep them firm. And then she said that my body fat will be redistributed into areas more consistent with a female. And my sex drive will be virtually none. And if I'm on the hormones long enough, the experiences when you would normally pleasure yourself, I guess, for lack of a better word, for male to female, you will no longer feel any discharge, none whatsoever, because the hormones will castrate, and you will no longer produce sperm like you once did. So that's basically what she said. She said things that won't change is your voice, the facial hair. You'll have to do electrolysis for that, for permanent removal. So when she asked me, are you still interested, I said yeah. And I signed all the papers, and then she gave me my first prescription. That was back in June of 2012, so that was 7 years ago. So I'm on hormones 7 years now, and despite a couple of setbacks, I'm pretty happy with the way I look and feel. I am much more able to not be self-conscious anymore. I go out, people address me as a woman or a ma'am or miss, so that's a good feeling. I also did vocal cord surgery in 2016 with Dr. Mark Corey at Mount Sinai. The surgery was successful. It changed my voice. However, I didn't have patience to go through with the voice training. So if I really want my voice to sound more female, I have to also do vocal training, but that's expensive. I tried it for like 6 months, but it was expensive, like $65 every week, and I couldn't afford that, so I had to walk away, just like with electrolysis. I had to walk away also. I did electrolysis on and off for 5 or 6 years, and I still have problems with the facial hair, upper lip and lower lip, and I shave still, which I wished I didn't have to, and I've tried numerous times to go back and be consistent, but you're talking about $70 a session for 45 minutes, and you have to be consistent, and I can't afford that. So I just have to be best with the shaving right now. And if I'm able to go back for the electrolysis, I'll go back to the lady who's been doing it for me for the past 4 years, because I like her. And I don't think she's going to retire anytime soon, so I still have that option. And now that I'm hoping to do this surgery, that's something I've been waiting for a long time, ever since I was 16. But it's a good thing that I didn't do the surgery earlier in my life, because I love my son, and if I did, I wouldn't be able to have that opportunity. And my son has problems, and I want to help him as best I can. And I'm heartbroken about it. But I love my son, and I would do anything for him. And if I never had my son, I wouldn't be the person that I am, you know? And I learn from my son, and he's an important part of my life. And though we don't have a great marriage, I still care about my wife. I love my wife, and she's the mother of my son, our son. So I'm fortunate. But now, when I came out in September of 2012, 3 months after I started hormones, I came out, but it didn't go well with my sisters, lots of my friends, who I thought were friends, and working-wise. My employer gave it some consideration. Initially they were going to be okay with it, but then it's a complicated story. But I used to work at a CPA firm, and I was getting stressed out during tax seasons, so I asked if I could maybe move on to one of their clients. And I happened to like this client in Bohemia where I did some work, and they hired me. But what happened was, when they were thinking it over, if I could transition, I was there already almost 3 years. The CPA firm that helped me get this job, the partner there wasn't thrilled about it, so he kind of talked them out of allowing me to transition, and I'm very upset with that, because I worked hard for him. I was very loyal and dedicated, and here he is telling them to let me go. And supposedly they said, oh, we have a better job for you. And they got me a job in the city with another one of their clients, who happened to be a pediatrician with multiple offices, and he was getting involved in the restaurant business as well. Well, I was there, I did my work, but I was very upset because they didn't treat me right. First of all, they didn't even hook up a phone to where I was sitting, which was odd. They never incorporated or invited me into their business meetings from day one, which was odd. The only time I ever got to talk to the owner was the very first day, when he wished me good luck, and that was it. And the practice manager promised me that I had nothing to worry about. They were fully embracing me as a transgender woman. And my hair wasn't yet grown. I still had short hair. So I had to wear a brunette wig, which I didn't feel comfortable about. But I got used to it, and for the most part, they were nice to me. They treated me with respect. They addressed me as Emily, even though my name's not legally changed yet to Emily. But all my paperwork was in my male name, obviously. And after 6 months, during the 7th month, the practice manager got mad at me for something that I was working on. She said, oh, how come you're waiting till the last minute to finish this? And it wasn't due until a month from now. And I got the assignment maybe a month and a half earlier, and she's yelling at me, and she's complaining and saying, you should have known better, Emily. I'm very disappointed with you. And I defended myself, and I said, this isn't due until next month, so what's the big deal? And then she said, I want you to think about it, and I want you to go home, think about it, and come in back in the morning, and we'll discuss it. I was so upset, and I left. I was really upset. I ignored everybody as I was walking out, and I didn't even want to take the subway. I just walked home from near where the New World Trade Center is to home, and I was so angry. And then the very next day, I was still angry. And she came up to me and she said, "It's not working out. We're going to give you 2 weeks and that's it." And I was so angry. And the next day, I had a sleepless night. My son was giving me some problems. He was having difficulties, meltdowns, and I couldn't sleep. And I went to work very tired, and I was disgusted anyway, because I knew it was only going to be another 2 weeks before they let me go. And when I went to turn to her, the practice manager, and tell her this is really not nice of you to do this, I fainted right in front of her. And she panicked, and she had these people lift me up to a couch. And I was dazed, and I was confused, and I was anxiety stricken, and all of that probably led up to my passing out. And then once I passed out and they awakened me and gave me water, I said I need to get back to work, and they said, "Oh no, you're going to the hospital." And I was taken to Bellevue Hospital, and I was there for 2 weeks. The practice manager who turned on me had the decency at least to call my wife to tell her I was in the hospital, but she didn't elaborate. She just said, "Your husband's in the hospital," and she told her where I was. I was at Bellevue Hospital in the city, and I was there for 2 weeks. They put me under intense therapy. They first wanted to see if I had damage in the fall, if I had any damage. So they took all kinds of x-rays, MRIs, and they found that everything was negative. So then they placed me in the psychiatric hospital, and I was there for 2 weeks. And they were nice to me. They treated me well. I talked to lots of people, became friends. And, that was my very first time in a psych hospital, believe it or not. And then they couldn't release me until I had a place to do my aftercare treatment with. So after they determined that Mount Sinai would see me on an outpatient basis, they had me sign paperwork that I could now be discharged. And before I got discharged, I made the phone call to my place of employment, which I thought was still there. And they said, "Don't bother coming in anymore. We're going to pay you till the end of the month, and you don't need to come to the office." I had left my jacket there with all the commotion of being taken to the hospital. So once I was out of the hospital and I went to my first session at Mount Sinai after I did the intake, and it was like 3 when we finished, and they said they were going to call me when I should start seeing their psychiatrist and therapist. So I walked down to where I used to work now. I called up and I said, "I want to get my jacket." And the practice manager said, "Oh good, because we want to talk to you." And I said, "I just want to get my jacket. I don't want to do anything else. I don't want to talk to you. I just want to get my jacket and I want to leave. What you did to me was cruel, and I don't like that, and I don't trust you. So I'm just there to get my jacket and get the hell out. I don't want to see your face again." And knowing me, I'm a very sensitive person, and I felt bad what I said on the phone, but I meant it. But I still felt bad. So she has a young daughter. She's grown up now. But when I was working there, she had a young daughter. She's a single mom. And overall, I thought highly of her. She's a nice lady. I don't hold any grudges. So I stopped in a like a toy store or whatever, and I picked out some plush toys and a couple of dolls and a bag of candy and a thank you card written to her for at least giving me the opportunity to work there. And I had it all in a bag. Most of it was for her daughter, and then the thank you card, because I have principles and morals, and I'm a good person. So when I got up, I said, they had the jacket waiting for me, and I said, just give this to the practice manager. And then I left. And then I get a call from her roughly a half hour later when I'm on my way home. And she said, that was so nice of you. You know, I'm sorry what happened, and I appreciate your generosity. You've always been kind, you know, and we liked you. And I'm sorry what happened. And as mad as I was, and as much as I wanted to curse her out for what she did to me and the owner, I just said, well, thank you for the opportunity. I'm sorry it didn't work out according to your plans. And, you know, I enjoyed the experience. And thank you. And then I just left it at that. And I said goodbye. And that was the last time I spoke to her. But at least I handled it the right way. I took the high road, but I was really angry. And if I let my emotions get the best of me, I would have cursed her out, but I didn't. As Michelle Obama said, when they go low, you go high. And that's what I did. I did it the right way, diplomatically. Because I don't like to hurt people. They hurt me, but I don't hurt them back. So, I've been out of work now for 7 years. I've been diagnosed with bipolar disorder, severe depression, suicide ideation, and of course, I'm male to female transgender. And I've been at Mount Sinai now in Callan Lord for roughly 7 years. And then when my therapist, who I was going to at Mount Sinai for like 3 years, and I thought I'd never change him, unfortunately, he had to move on. He got a position where he was going to be teaching now more. So he took that, and unfortunately he could no longer see me. And my psychiatrist was like musical chairs. I had like 4 different psychiatrists in that 3 to 4 year period. But I had my therapist for the full time. No change. And we developed a special bond, and he appreciated me, and he respected me as a transgender woman. And he shocked me towards the end when we were going our separate ways. And he said, you know I'm gay, right? He just off the cuff said, you know I'm gay, right? I said, I had no idea. I mean, I don't think about those things. And he said, well, that's why I empathize with you, because I'm also in the LGBT community, and I'm proud of you, and I know you'll do fine. And he wrote me a letter approving me to have the surgery, despite that he was worried about my mental issues, but he believed that I should be a good candidate for the surgery. And then I had to find a replacement. So I asked my doctor at Callan Wood, do you know if I can get a psychiatrist and a therapist at Callan Wood? And she said, sure, we have that department. So she put me on a waiting list with the psych department. And I got like a call like 3 or 4 months later. And they said that I need to come in for an intake. I went through the intake, I gave them my insurance and everything, and I started seeing them a week after for my therapy and my psychiatry, and everything seemed fine, and I was there for like 2 years until they dropped the bombshell on me and said, oh, we don't take any private insurance, we only take Medicare, and we assumed that your Medicare was your primary. But my Medicare was actually my secondary. It was my wife's insurance that was primary. So they said, well, we can no longer see you because we only have contract with Medicare. So I didn't have a therapist or a psychiatrist, and I had to go through the rounds again. And the first therapist that I had, which was at Mount Sinai, said that they were starting a program for transgender patients who wanted to do surgery, and they offer psychiatric and therapy services. And he said, if you want, I can get your name on the list. And I said, sure, definitely. And so after like a year that my name was on the list, I got like a phone call a couple of times in like the 2-month period, and they said, oh, we're going to get in touch with you to schedule an intake. And then it was like 3 months later, and I get a phone call when I was visiting a friend up in Maine, and got a call. I'm at the beach with my friend in Maine, and they said that you are no longer on the waiting list, we want to do the intake with you. And I said, well, I'm in Maine right now, and I'm going to be here for like another week. And she said, no problem. When you get home, call us, and then we'll take it from there. So when I got home, I called, and she scheduled me an appointment. I got approved for their program for transgender surgery. And I've been in the program now for 3 years, and within that 3-year period, I see my same psychiatrist. Unfortunately, they couldn't get me a therapist. I'm still on their waiting list. Seems like 3 years now. So I have a therapist in Long Island at Central Nassau Guidance Counseling, and I like him. He's good. He's far different from my therapist I had at Mount Sinai, but he tells it like it is, you know. Plus, he's a former sergeant in the Nassau County Police Department, so he's pretty tough. But he's seen transgender people, so it didn't faze him that I'm transgender. He said he saw it like every day in his career life. So, yeah, he's been helpful to me. And now I got approval for the surgery date, which is scheduled for September 10th. You know, and then this accident now is screwing me up. I've already had my surgery postponed 5 times because I wound up in the psych hospital where I detransitioned and I was all fucked up, you know, and I was so depressed. I had my hair cut short and I had nice, beautiful, long blonde hair, and I fucked it up by getting a haircut, trying to please, well, I love my son, and I felt bad when he kept saying I miss my dad. So I thought, you know, maybe I'll just get my hair cut, start wearing men's clothes again, and That will help him, but it didn't help me. I was so depressed. I had to wear baggy shirts that I got at Walmart that looked totally a mismatch because they were hanging down, but that was the only way I could cover the breasts. And it was awful. I hated it. I had to wear these baggy pants, baggy shirt, and I just couldn't take it. So after 2 weeks, I went to my psychiatrist and I said, I can't do this. I have to cancel the surgery because I'm not ready emotionally. And, he was okay with it. He said, look, I know you're going through a traumatic time, and when you're ready, then we'll go forward with the surgery. And now my hair is growing back. I'm very happy. Obviously, I'm happy now with the dresses I wear. So, I still feel bad for my son, but I always tell him that it doesn't matter what I look like on the outside. This is me. This is the way I feel inside, and I'm expressing it outwards. I'm no longer hiding, but I'm still your father, and I always will be your father no matter what. You have to believe that. And I know it's hard for him because he's autistic. Just like it was a struggle for me. When I was 3, I knew I was different. And I cross-dressed my whole life. And then there was times where I gave it up. I even got rid of all my clothes, put them in Salvation Army drop-off boxes or whatever drop-off boxes that were going to charity. But it was not good because then I'd find myself going out and getting new clothes. And it was just crazy. And then when I got married and we had a son, I kept saying, oh, I'm going to stop now. Everything's beautiful, everything's perfect. I'm a father, I'm a husband, I have a son, I have a wife, my mother-in-law loves me, and I just couldn't stop the dressing. I tried to quit, but it just wasn't going to happen. It was like embedded in me, and I couldn't get away from it. And it really was hard to deal with, And then I've been struggling. I always wanted to live as a female, and I couldn't take it anymore wearing clothes designed for women underneath my men's clothes. So I just had it, and I said, I need to get help. And that's when I called Callum Lloyd and started to see my doctor, Juliet Woodruff. And then in June of 2012, I started hormones. And that was it. I was ready to become a woman. And I haven't stopped since. With that little brief time where I considered detransitioning, but it turned into a total nightmare. So now, despite the fact that I was in a very bad car accident and my car is totaled, and I'm unsure if I'm going to ever be able to drive again, and that an insurance company is going to take a risk on me because now they're going to put me high risk, even though it wasn't my fault. So all this remains to be seen. But the reps that I talked to said, look, accidents happen. Obviously, this isn't your fault based on what you indicated. There was something mechanically wrong with the car. And that happens. But I don't have an attorney to help me prove that. But they're taking me at my word, which I'm being honest fully about. And I had the gap insurance in addition to the collision insurance and property damage insurance. So everything is covered. They're going to get their money. I'm not anymore going to be responsible for the car payments because the car doesn't exist anymore. And they're being paid off by the insurance, both e-insurance and Toyota Gap Insurance. And even Toyota said, we'll help you get set up with a car. And according to insurance, they said we're still going to cover you. And I'm hoping that that's true. And if it is, then I'll start looking for a car. Nothing on the scale of a Prius anymore. You know, just a dependable, reliable car. And if it's going to have to be secondhand, it'll have to be secondhand. As long as it's going to be reliable. Or I get a new car, but at a much lower price with much lower monthly payments. And I'll try my best to put some money down, even though I don't really have any. Certainly not on a credit card, though. And if I get another Toyota or a Hyundai, I'm going to go with a reliable car that's not expensive and break the bank. Because my Prius, when everything was said and done, with the warranty plan and the 4-year maintenance plan, and well, the gap insurance, I will always take out gap insurance now that I know what it is. But when all is said and done, that price tag went from $27,000 stripped to $36,000. And I could not afford that car. So maybe it was something that was bound to happen because I couldn't pay that car off at $500 a month with a $700 monthly premium for the auto insurance. So now if I get a car, I want to get a car for like, I don't know, 22 maybe at the most. I just don't know what the price of cars is, and I'm going to have to go with my friend Chase, who knows cars. And I'm going to have him help me decide on what kind of car I can get if everything works out with insurance and Toyota or Hyundai or wherever I buy the car, or Honda or whatever, that I can get a reasonably priced car that I can afford and that won't kill me over time with the monthly payments. So I have my work cut out for me. And I'm supposed to have surgery on September 10th. And I hope it goes through. And that's it for now, you know. I was hoping to go to the 40-year high school reunion, which is supposed to be in October. But in theory, if I don't have a car, I'm not going to be able to go. Plus, I'm going to have 3 months of recovery time. So if my surgery takes place in September 10th of this year, 2019, I'm going to have to recover for 3 months. So there's no way I can even attend that reunion as much as I wish I could. You know? So that's where I stand. So it's time for me to sign off. Oh, and thank you to that person out there who follows me on Facebook and sent me a beautiful gift card with $50. Let me see if I could show it quickly. So this is what they sent. They sent me an envelope, no return address. And I've showed this before, but just want to show my appreciation. This is the card they sent, a beautiful card. This is what they wrote. Can you see that? It's written to me, I think it's reversed, I don't know. And it says, Emily, I have been following your journey on Facebook and know you are a survivor. Just a small gift for you to buy something that will make you smile, a friend. Beautiful. It doesn't even have a date on it though. Nice card. And then they gave me this. Kohl's $50 Here's the card. Kohl's $50. I used most of it. I think the lady said I have like $8. It looks like $8 remaining. So I don't know if I'll ever use it, but I used it for what I wanted, thanks to this wonderful person, and has a heart of gold, and is very generous, and I'm grateful for it, and grateful for the beautiful words that they wrote for me. And I'll show you what I got. Just give me a minute as I put this beautiful card away. And this is what I got. I'll be right back. I'll be back, I promise. And as you can see, they sent me this dress. It's a beautiful dress. It's made by Elle. You know, it's kind of big, but you can see, well, I don't know, can you see? Yeah, you can see it. It's a beautiful dress. Kind of like the dress I like, but the one thing I like about it is its length. You can see it's much longer than the dresses I normally wear. So this is like a real woman's dress. And it was very nice that they gave me such a beautiful gift to allow me to get this dress. So I'll be right back as I put this away so I can say goodbye. I'll be right back. I told you I'd be right back. So here I am, and I showed you that beautiful gift because this person is so sweet. They follow me on Facebook, but for the life of me I have no idea who they are. But I want to say thank you. So I'll give an update as I get closer to the surgery date. And I'll let you know if it's all good. And I'll also let you know about my car situation, if you care. I hope so, but it really doesn't matter. Just, you know, I'm a good person, you know, I care about people. And it's sad that my sisters don't seem to care about me. And so many of my former friends, they couldn't care if I died, you know? Even if I died in that car accident, my sisters wouldn't care. And those friends that I used to have, they wouldn't care. They probably wouldn't even come to my funeral. So fuck them. Alright. Bye. I love you. And don't be shocked that I said fuck them, because I have a right to get mad. And if I feel like saying fuck, I'm going to. Nobody's gonna censor me. But I love you all. And I'm sorry I had to say that. But that's how I feel. Bye.